Meds clear, make your concepts clear. Welcome to my channel. Don't forget to like, comment, share and subscribe. Let's start with our topic. Pico monitoring. The things that I'm going to discuss in this video are its definition, its working principles, which include thermodilution and pulse contour analysis, the parameters that determines through the principles, and at the end, how to interpretate it. So Pico stands for pulse contour cardiac output, which is an advanced hemodynamic device. It determines whether a patient needs fluids or vasoactive therapy. Means through Pico we come to know whether we have to give fluids or the drugs, like vasopressors or ionotropes. This monitoring device work on these two principles, which is thermodilution and pulse contour analysis. Let's discuss each of these principles separately. In thermodilution we inject 10 to 15 milliliters of cold normal saline through this CVP catheter, and then this thermistor measure the temperature difference between the CVP and the art line. The higher the temperature difference is present, it means the cardiac output is low, as it would take longer time for the low cardiac output to circulate in the body, and due to which the temperature difference increases. They have inverse relation. When cardiac output is low, the temperature difference is high. And when cardiac output is high, the difference in temperature is low. This is what this graph shows. This thermodilution method not only determines the cardiac output, but it also determines these all parameters. With the parameter there is written its normal value. You just have to remember these normal ranges to be able to interpretate. Cardiac output is the amount of blood ejected by heart in 1 minute. Its normal value is 5 to 8 liters per minute. When we divide cardiac output by the body surface area, we get cardiac index. And its normal value is 2.5 to 4 liters per minute per meter square. Global end diastolic index means the end diastolic volume of all the 4 chambers. Or in simple words, the volume in both the atrium and ventricles before the contraction of heart. Its normal value is 680 to 800 milliliters per meter square. Intrathoracic lung volume index means the global end diastolic volume plus the volume of the lungs. Its normal value is 850 to 1000 milliliters per meter square. Then extravascular lung water index is the volume outside the lungs, like in interstitium. Its normal value is 3 to 7 milliliter per kg. If it's greater than 7, it indicates pulmonary edema. As you know, there are 2 types of pulmonary edema. One is cardiogenic pulmonary edema, and the other is non-cardiogenic pulmonary edema. So this pulmonary vascular permeability index tells about the type of pulmonary edema. If it is within 1 to 3, it indicates cardiogenic pulmonary edema. If it is greater than 3, then this means a person is suffering from non-cardiogenic pulmonary edema. Cardiac function index tells about the function of heart, and its normal value is 4.5 to 6.5%. Global ejection fraction tells about the volume of blood that is ejected in each beat, and its normal value is 25 to 35%. Now let's talk about the other principle, which is pulse contour analysis. It estimates the cardiac output based on arterial waveform. When aortic valve open, the pressure rises, as shown in this graph. This peak is the systolic blood pressure, which is normally 120 mmHg. This area is called the dicrotic notch, which happens when aorta closes. This area is called the area under the curve, which determines the cardiac output. So this principle determines cardiac output. Arterial blood pressure, which normally is 120 over 80 mmHg. Heart rate, which normally is 60 to 100 beats per minute. Also tells about the stroke volume, which is the amount of blood ejected by the left ventricle. And its normal value is 60 to 110 milliliter. Stroke volume and pulse pressure variation, which normally is less than 10%. And systemic vascular resistance index. It is the resistance in the systemic circulation, which is normally between 1700 to 2400. First, remember these normal values to be able to interpret the Pico monitoring, which I will discuss in my next video. Thank you for watching.